Hi, I'm Ashley Seplet and I am doing a breast and regional lymphatic assessment. And I would ask the patient if there are any changes or any concerns. I would look at the appearance of the breast. I would note the characteristics. These would be considered small and conical. They appear to be symmetrical in shape. The skin tone is even throughout. It's smooth. Currently at rest, I don't see any retractions or any dimpling or any lesions. You would note the characteristics of the areola. On real breasts, there would be nipples. And you would want to see that they would be symmetrical in size and shape and color. And texture, they could be from light pink to brown. You would note the characteristics of the nipples, being symmetrical in shape, the size and color and texture. You want to make sure that there's no lesions, no masses, no discharge or any leaking in someone who's not actively breastfeeding especially. Then you would re-inspect. You would have the patient to place their hands behind their head with their elbows bent slightly forward, and then you would check to see for that symmetricalness and for the dimpling and retractions, things like that. You would also have them put their hands on their hips and bend forward like that, and you would also check for those same items. Then you would have them just lean forward, and you would assess the breast for the dimpling and the retractions and other things like that. I would palpate the chest wall. Seeing for the related lymph nodes, you could do the supraclavicular up here. Sorry. I'll hold on to that up here. And then the infraclavicular just underneath. You would want to make sure that they're not tender, and they're probably not going to be palpable, no swelling, no hardness noted. Then you could assess the breast with the chest wall sweep. You would go down both sides, starting at the very top, all the way down. And you would be feeling for lumps and tenderness and swelling. And go to the other side, all the way down. And then you can also do the bimanual, and you'll be feeling all the way across for those, for any lumps or swelling. Okay. You would want to check the other lymph nodes in the axillary, and you would go from the first rib all the way out to the elbow. You would want to check for tenderness, any hard lumps, any that are not symmetrical in shape and size. You would go from the mid-axillary down to the bra line on both sides. Then I would have the patient to lay back in a supine position, and there are a few different ways that they can assess the breast, and they can also do these at home. I would advise them to check their breasts at the same time of the month, every month, on the preferred days, days 4 through 7 of their menstrual cycle. And if they are menopausal, then they need to pick a day that is going to be easy to remember, so that they can get them done around the same time monthly. And they want to also be sure that they're checking in the same pattern. So we can check in a circular pattern. They're going to be making sure that they start inward, and they're going to work all the way out just making sure that they're looking for those lumps. We do it on both sides. They can do a vertical stripe pattern where they could start up and then work their way down. And you would do that to both sides. And then they could check in the wedge pattern. They're going to be going from the center out, kind of like around the clock. Making sure that they just hit all those areas. And they would do this to both sides. You want to be particularly watching this area up here. It's closer to all the lymphatics, and that's usually where you would turn up with cancerous lumps, things like